Understanding the nuances of child abuse and neglect is important for mental health professionals. This episode is a companion to the 2 CE Hour Child Abuse and Neglect training course by Therapy Trainings. We'll highlight the various types of maltreatment, discuss its prevalence, and share ways to identify and support victims, providing valuable insights to enhance your practice. Throughout this episode, we'll break down the foundational understanding of child maltreatment, discuss signs and symptoms to look out for, and cover evidence-based interventions that can make a real difference in the lives of those affected. Additionally, we'll tackle some common misconceptions surrounding child abuse and neglect, shedding light on the realities that often get overlooked. So, whether you're currently working in this field or just looking to expand your knowledge, get comfortable and let's jump in. Let's start with the basics. What exactly is child maltreatment? Child maltreatment encompasses a range of harmful behaviors directed toward children, and it can take several forms. The major types of child maltreatment include physical abuse, emotional abuse, sexual abuse, and neglect. Each of these types has its own set of characteristics and consequences. Physical abuse often involves inflicting physical harm onto a child, which can manifest in various ways, from hitting and kicking to more severe forms of violence. Emotional abuse, on the other hand, is less visible but equally damaging. It can include verbal assaults, constant criticism, and rejection, leading to severe emotional scars that might not heal easily. Sexual abuse is another horrifying reality that some children face, involving any sexual act or exploitation. Finally, neglect, which is the most prevalent form of maltreatment, occurs when caregivers fail to provide for a child's basic needs, whether that's food, shelter, medical care, or emotional support. Now, you might be wondering, how prevalent is child maltreatment? According to research from the U.S. Department of Health and Human Services, around 1 in 7 children experienced abuse or neglect in the past year. That's a staggering statistic that highlights the urgency of our work. The effects of maltreatment can be lifelong, impacting a child's physical, emotional, and psychological health. This is why it's crucial for professionals like us to be informed and prepared to intervene. As we delve deeper into the signs and symptoms of abuse and neglect, let's consider how they can manifest in children. Physical signs might include unexplained injuries, frequent bruises, or signs of malnourishment. Emotionally, children may display signs of anxiety, withdrawal, or aggression. It's important to remember that these symptoms can vary significantly from one child to another. So, how can we effectively assess whether a child might be experiencing maltreatment? In the course offered by Therapy Trainings, we learn about the importance of conducting thorough assessments. This means not just looking for physical signs, but also examining the child's emotional state and their home environment. Engaging in open dialogue with the child, when appropriate, can also provide invaluable insight. Sometimes it's about creating a safe space where children feel they can express themselves without fear of judgment or retaliation. Now, let's shift gears and talk about interventions. What can we do to support these children? First and foremost, understanding that each child is unique is essential. Evidence-based interventions, as covered in the course, can range from therapeutic approaches, such as cognitive behavioral therapy, to family support services. The key is to tailor interventions to fit the individual needs of the child and their family. For instance, in cases of trauma, therapies that focus on trauma-informed care can be particularly effective. These approaches help children process their experiences in a safe and supportive environment. Additionally, involving caregivers in the therapeutic process can foster healthier family dynamics and contribute to a child's recovery. It's also worth mentioning that holistic support is vital. This means considering not only the psychological needs of the child, but also their physical, social, and emotional well-being. Collaborating with schools, community organizations, and healthcare providers can create a network of support that addresses all aspects of a child's life. Now, as we explore these concepts, it's essential to address some common misconceptions about child abuse and neglect. One prevalent myth is the belief that abuse only occurs in families with low socioeconomic status. In reality, child maltreatment crosses all demographic lines. and it can happen in affluent families just as easily as it does in families facing economic hardship. By challenging this misconception, we can approach this issue with a more comprehensive understanding. Another misconception is that children will always disclose abuse when it happens. This isn't always the case. Many factors can inhibit a child from speaking out, including fear of retaliation, feelings of shame, or loyalty to the abuser. Therefore, it's our responsibility to be vigilant, to look for signs, and to create environments where children feel safe to share their experiences. As we bring this discussion to a close, let's reflect on the profound impact that informed professionals can have on the lives of children who have experienced maltreatment. By understanding the complexities of child abuse and neglect, we position ourselves to be effective advocates, educators, and healers. I encourage you to think about how you can utilize the information shared in this episode and the course provided by Therapy Trainings. Consider how you might implement some of these strategies in your practice. Engage with your colleagues on this topic and perhaps even explore additional training opportunities that can further deepen your understanding. Knowledge is power, and in our line of work, it can be transformative. If you're interested in expanding your knowledge further, I invite you to visit therapytrainings.com. There, you'll find a wealth of resources, including this course on child abuse and neglect, along with many other training programs designed to empower mental health professionals like you. Thank you for joining me today as we explored child maltreatment and the crucial role we play in addressing this important issue. Remember, every child deserves a safe and nurturing environment, and together we can make a difference. Stay informed, stay engaged, and let's continue to advocate for those who cannot speak for themselves. Until next time, take care.